Hello, everyone, and welcome to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a bilingual neuro-linguistic programming and cognitive behavior psychotherapist specializing in anger management issues, both court-appointed and private, marriage counseling using the EFT method, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also do provide life, business, and retirement coaching support. I provide individual one-on-one session in both French or English and also do group settings. If you need any assistance, reach out to DMV Therapy and Coaching Services at 301-325-1550, and our website can be found at lifecoachdanamzalek.com. Today, I'm very excited to have for our second episode of season 15, a very special guest and coach for healers, Kristen King. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Kristen, the floor is yours.
Thanks, Dr. Dan. Hi, everyone. I am Kristen King. And as Dan said, I am a coach for healers and change workers. I work with service-based entrepreneurs to help them create a business that looks and feels like them rather than one where they feel like they're failing because they're trying to cram themselves into someone else's blueprint. And a lot of the folks I work with have mental health stuff that they need to take care of. They may have chronic physical health stuff that they need to take care of. And what we're really trying to do here is help people create a business and a life that really fits their needs instead of burning them out and making them feel overwhelmed and frustrated and sad all the time.
Well, thank you so much, Kristen, for being here today. So, as we discussed on our pre-podcast call, we're going to cover the topic of chronic health issues. And I know that a lot of people that are dealing with that, with fibromyalgia and other illnesses and all. So, tell me exactly, what was your own journey dealing with chronic health, and what did you do to be able to cope with having to know to deal with it for the rest of your life?
Yeah, so my journey started pretty young. Around fifth grade was when I started to have issues that required more and more attention. And the places where that showed up for me at that young age that I continue to manage much more effectively now were things like significant anxiety, significant depression, significant digestive issues and challenges with sleep as well that went along with all of that stuff. And I've gone on over time to get diagnoses for some of those things that help me sort of better understand the options for managing it. But other of those things are still kind of open loops, despite some pretty Herculean efforts by myself and others to figure out exactly what's going on. But where things really started to have a big impact for me was in college. After I went through a personal trauma, my brother died, so I experienced the loss of a sibling, and that was kind of the last thing that pushed me over the edge to where I couldn't really ignore the mental health stuff or the physical stuff that had been going on for so long, and I started to have to really pay attention to it. And so that was when I started working with some professional support, starting to work with a GI doctor, a therapist, trying some medications and that kind of stuff. And we got some progress, but then what I also realized was that even though some things were getting better, they still weren't great. And that was one of the things that kind of pushed me into entrepreneurship because at that time I was working a full-time job for someone else. I was commuting, I was working long hours. I had to fit into the norms and expectations of this work environment. And it was just exacerbating all of the issues that I was already having. And it was really making me sick. And so that was what pushed me to actually leave full-time employment and to become an entrepreneur myself because I needed an environment where I could take better care of myself and create a life and a work life that really matched who I am as a person.
I see. Well, thank you so much. And when it comes to the mental aspect of dealing with chronic health issues, did it
Mhm.
bring any depression, any anxiety or additional anxiety that you didn't have before, or how did you manage all that together?
Yeah, I would say I managed it badly, Dan. I managed it badly. But what I really noticed there is that when my physical body is not getting what it needs, my mental health significantly suffers. when my emotional, psychological body is not getting what it needs, my physical health suffers. And so it became really clear to me how sensitive I am to stress, how sensitive I am to the need to perform, to perfectionism and people pleasing in response to other people's expectations of me. And those are areas where I have to really, really be careful. And so one of the skills that I spent a really long time learning, and I feel like I've only really mastered it in the last 5 years ago, or so rather, it's just saying no. Like if someone asks me to do something that's beyond my capacity, if I just have too much on my plate and I know that this is going to be the thing that takes me from a simmer to boiling over, I just have to say no to it. And it's not like some like moral obligation. It's like if I say yes to this, I'm going to cause myself significant harm. And so because I choose not to intentionally cause myself significant harm, that requires me to say no to things that are going to do that. And that has really been a huge tool for me. Also, I experience, some people call it time blindness. Like I will hyper focus on things. One of my I am neurodivergent. I have ADHD, and one of my superpowers is hyper focus. But along with that comes time blindness. I also have what I think I coined this term, time optimism, where I think that I can do things a lot faster than I can. And in a perfect world, I probably could do it that fast, but it causes me, or it has in the past, caused me to estimate timelines or to take on things that I could theoretically accomplish in a perfect world, but it didn't account for my own humanity. And so I had to be really realistic and honest with myself about what I actually could do and also what I actually should do to not completely use myself up and create a situation where I'm going to be recovering from that yes for weeks or months. And so that it goes along with saying no, but the awareness of the time optimism where I need to account for me doing it with my need for mental breaks, for physical breaks, for whatever is going on with me at that time. I got to factor that in and maybe be a little less optimistic about how fast I can do stuff.
But do you think that the perfectionism aspect or attribute that you have, this is what causes so much stress because you just want everything to be done perfect. But then again, with the time constraint that you allow yourself to be able to operate in, is doesn't allow you to really offer quality work because then if you're trying to
Yeah.
rush, you're just kind of like jumping hoops or you're trying to cut corners and then your product will suffer.
Yes. I think that's a huge, huge factor. I am a lifelong gold star earning top of the class A student, good girl. And I have been in active recovery from that for about the last 5 years. And that pattern and also like hypersensitivity to rejection or the sense that I have failed are a really excellent recipe for burnout. And so that is something that I have had to really pay attention to, not from a fear-based perspective, but just from an awareness perspective. I have to really check in with myself and not just say an automatic yes to something. I have to really say, okay, hold up. What can I actually do here without causing harm? And within those limitations, how good am I willing to have it be versus how good would I like to have it be in a perfect world, right? So that balance.
Mhm.
But until I learned how to better have those conversations with myself, the perfectionistic drive and the fear of failure and disappointing people and that sort of thing would have me so stressed out about doing stuff because I was afraid I couldn't do it right that I would push it off and push it off and push it off, right? Like I'd procrastinate on it because I was scared of not doing it well enough. And then I'd be at the 11th hour in a panic trying to get things done. And that is just such an awful cycle. And in some ways, I do thrive with a lot of input and I do thrive under stress in certain circumstances, but not as a permanent condition of my existence. And that was the one that I found myself in for many years.
So would you consider yourself as an HSP?
I would consider myself a highly sensitive person. I definitely have literal like sensory issues in terms of sounds, brightness, just amount of input, certain textures. Those are definitely things that I've always been very sensitive to. I also have a body and a brain that notice things very earlier than most people do. So like I'll go to the doctor before I test positive for strep because I can feel that this is happening, but it's earlier than the test will read it, for example. So I have like a high level of sensitivity in my body and in my brain in terms of detecting things that are off with myself. And then I also have a high level of sensory input. And although I have not received a formal diagnosis in this, because it is, as I imagine you know, as a professional in the behavioral health field, it's very difficult to find people who will diagnose adult women as being on the autism spectrum, but I am 100% sure that I am on the autism spectrum in addition to having the ADHD stuff and the other things. And a lot of the sensory things and the sensitivity, as you know, Dan, go along with that. And so it's all part of the ecosystem that I operate in. And I see it in my kids as well. I have 11-year-old twins,
Okay.
and they have a lot of very similar physical and emotional patterns to the ones that I have experienced.
Did you diagnose him with Asperger? Or I mean, I know that if you're a highly functional autistic person, you must be having Asperger. But do you feel that with your kids, did they take that part of you or that side of you in terms of autism, or they just needing more focus, ADHD, or whatever it is?
I think that they both we have not formally pursued a diagnosis for that. All of this stuff has started to emerge during COVID, and so we've been a little conservative with, things are opening up a little bit more, but they were pretty closed down for a while because they do have a lot of other health stuff too. I have like respiratory issues and all kinds of things that could be affected. So we haven't pursued official diagnosis for either of those things, but as a lay person who did in fact work as a non clinician professional in behavioral health for a decade, I'm 100% sure that they both have ADHD and are on the autism spectrum. And I know that, we don't in like the DSM, like we're not really using like Asperger's or like high and low functioning and stuff anymore, but as you're saying, they're different. It is a spectrum,
Yes.
right? And so there are different levels of how much it interferes with everyday life compared to people who maybe don't have that same experience. And so, for my kids, it's a lower level of interference, but there's still a lot of stuff that we just got to plan for and attend to, and that they're developing self-awareness of in themselves, but also like how their stuff interacts with the rest of the family at a much younger age than I did. And so I'm really thrilled that I kind of know what that's like, so I can support them to avoid some of the avoidable challenges that I did not know how to get around.
I see. Now, do you feel because you suffered, I mean, you're suffering from autism or the most functional one, so it's easier for you to be able to see the signs in your kids?
Um, sure. I also I wouldn't say that I'm suffering from it. I'd say that I'm living with it.
Okay.
Um, but I think that because I do have that high level of sensitivity and awareness in myself, because I have worked in behavioral health for a really long time. I worked for a public health consulting firm where I specialized in mental health and trauma. I've been in this space for a long time, and I know what my experiences were, and I know what I wish I had known as a kid looking back. And now that I've sort of been able to observe myself having this experience and find ways to support myself, I have capacity to observe what's happening for them and to offer them ways of supporting themselves, and also, creating adjustments in our family that are good for everybody.
Mhm.
And so I think it's a combination of exposure and practice in a professional environment plus awareness and lived experience. I think it's the two together.
Did you have to take any medication to be able to deal with the chronic health issues or the chronic pain, or are you still on medication, or you're trying to do everything holistic? What exactly is your approach?
It's a mix. So initially, when I first started seeking a formal diagnosis and professional support in my early 20s, I did try a number of different medications. It was mostly antidepressants, anti-anxiety medications, and mood stabilizers. I received a bipolar diagnosis in my early 20s, and I no longer check all of the boxes for that. And my belief is that, as frequently happens with women, a lot of women get diagnosed with bipolar disorder when they actually have ADHD and are on the autism spectrum. And so I think it was one of those like close but not quite kind of deals. So we tried I don't even remember how many different meds, but I do have, as I mentioned earlier, a body that's very sensitive to changes and outside input. And like you get the package inserts from the pharmacy that are like, 1 in every 2 million people might experience this thing. There's a 0.00001% chance.
You were
I
that.
am that person. I have every undesirable side effect known to man. I've had 5 abdominal surgeries, and I can only take Tylenol and Advil because I have terrible reactions to all painkillers. And I can only take like 2 kinds of anesthesia, so I can't do sedation dentistry because I have a lot of other stuff going on. I have some like genetic mutations that make it hard for me to process things in my body to methylate. And so a medication that has a half-life of say 24 hours and a typical person who doesn't have this thing might last days or even weeks for me. And so I discovered that at that time in my early 20s, there were no medications that didn't give me intolerable side effects, and that like we just couldn't find any. And it was so bad that I got to a point where I wasn't willing to try anymore. And
Yes.
so that was when I took a very, I would say, aggressive approach to holistic management. I did, continue working with a therapist, and I love therapy. If you're not in therapy, you should totally do it. It's amazing for everyone. I also sought out peer support. I got trained and certified in some evidence-based self-management wellness practices. I did all kinds of dietary stuff.
Yeah, was it
And that,
that
yeah. So like that,
it could
it's
be an
like
autoimmune
supplements.
disease as well, right?
What was that again?
It could be an autoimmune disease that you had that was not really diagnosed in terms of like either celiac or like not be able to digest certain food that cause all
Yes.
symptoms.
Yeah, there was a lot of stuff, and I still believe that there's autoimmune stuff going on that we haven't quite figured out yet. But one thing we figured out in the last say 10 or so years is that I have a thyroid condition. I
Hypo.
have adrenal stuff, and so I do take medication for my thyroid condition. I take that every single day. I take adrenal supplements to help with my adrenal functioning and stress management and stuff. And then I actually, in about 18 months ago, started taking ADHD medication. I take Adderall, and that has been amazing. And it's like the dose that I can tolerate is a little, like, not quite enough for the full effect that I want. And so we augmented that with Wellbutrin because that has off-label effectiveness in ADHD. So the thyroid, the Adderall, and the Wellbutrin, and then like the nutritional supplements are something that I do every day. And the side effects from those are not non-existent, but they're all ones that I can live with. And so it's worth it.
So do you think, I mean, now with the trifecta of the medication that you're taking with the levothyroxine, are you taking Synthroid or levothyroxine?
It is, what am I taking? It's Armor, whatever the, oh, actually, no, we changed from that. It's NP thyroid.
Oh, yeah, the most common one are Synthroid,
Yeah.
levothyroxine. But for the Adderall and the combination of the other medication, that you have
Mhm.
those side effects that are more pronounced because you're mixing so much. One, because the Adderall focus on, I mean, it's primarily for the focus. The TSH, the lack of TSH because of the thyroid hormone, you need to
Mhm.
that I would say accelerate your metabolism. So you're basically overactive now with everything that you're taking.
Yeah, I think that is an accurate way to describe it. And I would say that well, if I were to have like say 3 cups of coffee instead of 1 cup of coffee after I've taken Adderall, it's like I'm vibrating out of my skin. But I've always kind of had highs and lows in terms of my energy. I've always had kind of an appetite that comes and goes, and because of that hyper focus and that time blindness, I've always sort of forgotten to eat.
Yeah.
And so I had a lot of structures in place in my life already to help me. Like one of the really common, side effects of Adderall is like loss of appetite, and like thirstiness. Like you're really thirsty, you'll have like a dry mouth, and you forget to do those things. But I already had trouble with that. So it wasn't really new, and I already had systems in place to deal with it. So so there, I definitely pay closer attention to it, and I track my weight more now that I'm on the medication than I have in the past, just to make sure that I'm not missing anything and I'm not taking in too few calories. But I already had to attend to that. So it hasn't been a big change in my life to have those kinds of things added on. I'm just a little bit more aware of them than I was before, but it hasn't been problematic in ways that weren't very easy to resolve.
Because those dealing with hypothyroidism, they tend to have the tendency to gain weight because of a slow
Mm-hmm.
metabolism. But the fact is that did you feel that your weight was gaining because you were not treated with hypothyroidism medication? Or what made you feel that you needed to get tested to determine your T3 and T4 level cells?
Yeah, for me, a couple years ago, I guess it was more than a couple years ago. It was probably like eight years ago.
Oh, that's more.
Um, yeah, it's been a couple. I'm like, wait a minute, what year is it? Time is so weird. It's so weird. But anyway, I had some pretty bad health stuff happening all at one time. And it was like my hair was falling out, my